Hey everyone. In this podcast presentation, I'll be talking about the possibilities and precarities of paying people for lived experiences in the context of peer research, and some of the implications for social work. This discussion is based on an article that in 2021 was published in the British Journal of Social Work. So if you're interested in taking a deeper dive into the political economy of peer research, please check out our paper there. First, I'm going to give you a quick introduction. My name is MacKinnon, and I'm an assistant professor in the School of Social Work at York University. And I'm giving this presentation on behalf of my co-authors, who are Adrian Guta and Voronka, assistant professors in the School of Social Work at the University of Windsor. Merrick Pilling is an assistant professor in the Department of Women and Gender Studies at the University of Windsor. And Laurie Ross is an associate professor at the Dal Lana School of Public Health, University of Toronto. Dr. Ross is the principal investigator of a larger project from which this podcast is based, called the Peers Examining Experiential Research Study, or the Peers Project for short. This project was funded by a SSHRC Insight grant. You may be wondering what prompted this research. Backgrounding this work are a few important contexts to draw attention to. First, community-engaged participatory research, or collaborating with community members to co-conduct research, has become increasingly popular in health and social care research, including social work. In participatory research, community members are engaged to work on projects, and they're often referred to as peer researchers or peers. Peers are typically community members within a target population under study, people of whom the research outcomes have critical consequence. And peers work on a range of different tasks, such as data collection, analysis, and knowledge dissemination. For example, I'm a queer trans person, and before I finished my PhD, I was employed a few times as a peer researcher on various projects focused on LGBTQ health issues. And I was hired to work on these projects in part due to my personal identities, lived experiences, and community connections. Some of the aspirational promises of peer research are that partnering with community members will produce better quality or more accurate data, as well as democratize the knowledge production process. And as we're all likely familiar, traditional academic knowledge production has often excluded people from marginalized communities, and epistemic injustice has been done by consequence. Peer researchers are also usually financially compensated for their involvement to value their time and community knowledge they hold. Though, as we'll start to unpack through this podcast, compensation rates and payment practices can range significantly. Now, what does this have to do with social work? Importantly, social workers have been identified as serving in a quote-unquote gatekeeper role in hospitals or community organizations, providing to researchers access to potential peers. And at the same time, our own social work code of ethics implores social workers to educate colleagues about responsible research practices. So the practices happening in peer research are of concern to social workers and the people and communities who we aim to support. Another relevant context here is a decades-long project of neoliberal reform, which has eroded the welfare state and promoted marketization of all domains of life and work, from business to health and social care provision. The global financial crash of 2008 and resulting austerity measures in the UK, the US, and here in Canada really amplified labor market trends, which produced significant precarity. Economic precarity in the labor market refers to unemployment, underemployment, and the patching together of multiple short-term contracts. Of course, in social work, we know all too well precarity to be associated with low income, mental health concerns, and food and housing insecurity as well. And these social and economic material realities are not equally distributed across the population. These trends interact with racism, with sexism, with disability, with saneism, with homophobia, biphobia, transphobia, and colonialism, to name just a few of the discriminatory dimensions of precarious employment. And around the same time period that we're witnessing the expansion of precarious employment, we also see peer research becoming increasingly popular and practiced, especially by researchers who are seeking social justice in the knowledge production process, and to redress some of the past harms done to marginalized communities by the research enterprise itself. As a final background point here before we move on to discuss the Peers Project, my colleagues and I note that there are very few studies investigating the experiences of peer researchers involved in this work and what their actual work conditions are like. Here's a quick note on methods. To understand critically and materially the experiences of peer researchers, we conducted the Peers Project. We were guided by our own social justice aims. Reflecting these, we followed constructivist grounded theory developed by Dr. Kathy Sharmas, explicating how peers' work conditions are shaped by and intersect with structural processes. Following our own participatory study design, we hired 5 research assistants who brought lived experiences working as a peer researcher. Peer research assistants on our project collaborated on recruitment, data collection, and analysis. And since we're talking about social justice for peer researchers, we also note that they were paid an hourly rate on par with non-peer research assistants doing similar work within the standard pay range set by the University of Toronto, their institutional employer. Then, our team recruited 34 peer researcher study participants to participate in interviews. They were included on the basis of having, in the past 10 years, received financial compensation to work on studies in 4 domains: racialized communities, communities of people who use drugs, consumer, psychiatric survivor, ex-patient, and MAD communities, and trans non-binary communities. Study participants had worked in academic, hospital, and community settings. Reflecting intersecting identities, some participants had worked in multiple communities. The 34 interview transcripts were analyzed according to the DEPICT approach developed by Drs. Sarah Flicker and Stephanie Nixon, which incorporates community engagement into qualitative data analysis. Peer researchers working on this study co-developed a codebook of research findings and coded the transcripts, drawing out themes happening in peer research across the 4 communities. So what did we find? I'm going to turn now and present some of the participant excerpts. Overall, though we uncovered significant divergence in the work experiences of peers across studies, many participants had experiences of working as a peer researcher on multiple projects. We also uncovered a range of compensation strategies and wide variation in the payment received, as well as differing levels of satisfaction with work conditions. First, it's very important to note that some participants offered positive accounts of their work and felt very valued on research teams. That said, the theme of economic precarity was salient across most interviews. Some people noted being compensated with honoraria, others were provided short-term casual contracts, and although rare, one participant reported full-time employment. Some participants talked about their compensation being inequitable in comparison to non-peer team members. For example, participant number 1 said, and I quote, "It's that institutional hierarchy that a lot of us peers are under, and they only let us move so far. And then there's a control thing going on and it needs to stop. Because it's like we're being used. Okay, you're here, you're an expert, we recognize your expertise on this and this and this. And then it's, oh, but you can't come up here." We were getting paid, I think it's 20 an hour, which is pretty good, but it wasn't steady. It's very precarious. It's a few hours here and there. Observing this, the quote-unquote expert by lived experience status may be rhetorical and limit opportunities for advancement into more secure employment within research. Other participants discussed supplementing peer research work alongside government income assistance and the value of being compensated in cash that would not result in their state income support check being clawed back. Participant number 19 shared that, and I quote, "Because I'm on ODSP disability support as well, so they take half my money. So I mean, I know maybe it's illegal, but it's nice to get money, cash. The other couple of projects were cash after that." This participant noted formal labor market income triggered a disability support clawback, which resulted in, quote, half of her earnings being withheld. This also shows the wide spectrum of payment mechanisms used across projects and what may be at stake with these payment methods. Several participants who were paid through honoraria discussed within interviews the tasks they did and the total number of hours they worked. With that information, we were able to roughly calculate that many of these honoraria fell below the provincial minimum wage standards. Now, moving on to discuss these findings, we underscore that involving peers in research is set to promote democracy and social justice in knowledge production. Yet, our analyses show that in many cases, the peer researcher role is characterized by precarious working conditions, which may amplify rather than challenge injustice. In the interest of time, here are a few take-home messages and overall recommendations for social workers in the field and those more directly involved in participatory research. Point 1. Informal honoraria obscure the actual hourly rate paid for peer research work. Wherever possible, peer researchers should be given transparent contracts or placed on institutional payroll. Or at minimum, the hourly rate and hours to be worked need to be better communicated to peer researchers before they agree to join a project. Social workers who are involved in intermediary roles could mediate these discussions between a principal investigator and a potential peer researcher. Or they could even advocate alongside peer researchers for better working conditions. In this scenario, social workers have a professional obligation to assess peer research opportunities for potential exploitation of clients' lived experiences and labor. Point 2. Payment practices between peer research and non-peer research roles on the same teams ought to be aligned. Peers hired to work on projects should have access to the same benefits as other paid research staff, for instance, paid sick leave. And if engaged in doing similar tasks, be paid at similar rates. Point 3. Paying peer researchers who are particularly economically marginalized and accessing state income supports is complex. Some participants in our study discussed the importance of being paid with cash honoraria due to government assistance clawbacks. In these cases, cash compensation at the end of the month will often make a bigger impact when people are waiting for their next government payment. And if institutional policy requires honoraria be paid using a gift card rather than cash, we stress that peer researchers be involved in selecting the type of gift card without any judgment over their decision, for example, whether they select a grocery store or a fast food restaurant. In closing, these findings on pay discrepancies and precarity in participatory research provide us with a litmus test colored by broader labor market conditions. Research institutions have clearly not been untouched by neoliberal labor trends. Still, despite an imperfect process, partnering with communities is of critical importance to inclusive knowledge production and is imperative for future health and social service development. Now, that said, we conclude with centering the need for pay equity across projects and for social workers to engage in these advocacy efforts. Thank you so much.